I'm Audrey and this is my mastication model. So starting off the model, we have the boundaries of the oral cavity, and those structures include the lips, the cheeks, the hard and soft palate, and the floor of the mouth. So the primary function of these structures of the oral cavity is that it helps intake foods and liquids for digestion. And then so for speech, it's important because the oral cavity and its structures are essential for speech production because they play a huge role in articulation, resonance, and sound modification. So next on my model, we have the boundaries of the pharyngeal cavity. And the boundaries of the pharyngeal cavity include the nasopharynx, oropharynx, and the laryngopharynx. And the primary function of these structures is that it serves as a dual passageway for respiration by moving air from the nasal cavity to the larynx and then the lungs. And then it also helps in digestion as it moves foods and liquids from the oral cavity to the stomach. So looking at specifically for speech, the pharyngeal cavity plays a very important role in speech because it will have an impact on resonance, vowel articulation, and the control of airflow, which are all essential for the clarity and intensity of speech sounds. So the pharyngeal cavity is up here, and then next we have the boundaries of the laryngeal cavity, which is down here a little bit further. And the boundaries of the laryngeal cavity include the false vocal folds, the true vocal folds, the cricoid cartilage, and the laryngeal inlet, to name a few of the most important structures in that cavity. And the primary function of this cavity is that it will protect the airways from food and liquid or other foreign particles from getting into the lungs during respiration. And then for speech, the laryngeal cavity is very important because it plays an important role in the impact of phonation, pitch control, intensity, and loudness of speech sounds being made. So behind that is the esophagus, which is this long tube right here. And the esophagus's primary function is the transportation of food and liquids from the pharynx to the stomach via coordinated muscle contraction downwards. And so for speech, the esophagus is also important because if an individual has had an injury to their larynx, they will use their esophagus to produce certain speech sounds. And also the esophagus can have an influence on the resonance of speech sounds because it helps to keep the pharyngeal and oral cavities clear. And also near the pharynx and the larynx, right here is the epiglottis, which will fold over during swallowing to protect the airway. So when you swallow, this will go down to make sure any food or liquid that you're swallowing does not enter the trachea. So looking inside the oral cavity, we have the teeth on both the top and the bottom, and then the tongue in the middle, which is made up of the apex, the body, and the base. So those are just some important landmarks on the tongue and how we can kind of tell what's going on. So the tongue's primary function is that in mastication of food, it will push the food back towards the back of the mouth, and it will also help to detect the flavors of the food using taste buds. So for speech, the tongue is also extremely important because it will play a huge role in the articulation of certain speech sounds, and the speed of the movement of the tongue is also very important for the rhythm and pacing of speech. So the tongue is made up of very important muscles, and these muscles share the primary function of moving food in the mouth to make food easier to chew, and it will also push the food towards the back of the mouth to help initiate swallowing. And for speech, these muscles are also important because they will adjust to help shape and position the tongue, which allows for a wide range of speech sounds to be made. So some examples are like the styloglossus, which this muscle will lift the lateral edges and retract the tongue, whereas such as the genioglossus will protrude the tongue anteriorly and help to deviate the tongue to the opposite side for that side-to-side movement. So another important muscle in mastication is the masseter, which is this muscle right here. And this muscle's primary function is elevation of the mandible, which will bring the teeth together in chewing. So this movement right here, helping to grind down that food using the teeth. So for speech, the masseter is also very important because it will stabilize the jaw and allow control over jaw movements, which is very important for speech production. And it can also be important when looking at the degree of how much the jaw is open, as that will also affect what sound is being made. So another very important muscle in mastication is the temporalis. And when we think about our own anatomy, this muscle would be up by the temporal bone. And this muscle's primary function is similar to the masseter in that it elevates the jaw, but it also will retract the jaw for chewing and positioning the jaw, which is very important. And then in speech, the temporalis is important because it will again maintain that jaw control and stability. for articulating those speech sounds, and it will also help to support clear, precise sounds. On this side of the model, we have my lateral and medial pterygoids, and these muscles are very important in mastication, but their primary function varies a little bit between the two. So the lateral pterygoid allows for forward jaw movement and side-to-side movement for that rotary chew, and the medial pterygoid will allow for the elevation of the mandible and again that side-to-side movement. And for speech, these muscles are very important because again, they will control that jaw movement and stability, which is essential for both mastication function and precise articulation of speech sounds. And next we have the muscles of the velum, which would be located right here on this bend. And the muscles of the velum have the primary function of elevating, tensing, shortening, and lowering the velum, which will all aid in the swallowing process by changing the pressure and position of the velum. So for speech, this is important because the muscles of the velum will control the airflow between the oral and nasal cavities to help support clear articulation and appropriate resonance for both nasal and non-nasal sounds. So some examples of these muscles would include the palatoglossus muscle, which will elevate the posterior portion of the tongue. Also, the palatopharyngeus muscle, which function is to tense the soft palate and pull the pharyngeal walls superiorly, anteriorly, and medially during swallowing, which will effectively close off the nasopharynx and oropharynx. So next is the salpingopharyngeus, this muscle right here, which might be kind of hard to see, but is represented by those lines. And this muscle's primary function is that it is responsible for the elevation of the pharynx and the opening of the eustachian tube, which will help to equalize the pressure between the middle ear and the nasopharynx during swallowing. And this is also important for speech because it will contribute to the pharyngeal movement and resonance needed for speech, and it will also help to enhance voice quality and aid in the separation of nasal and non-nasal sounds. So continuing on the posterior side of my model, we also have the muscles of the pharynx, and these muscles have a wide variety of roles. However, they all involve the movement and shaping of the pharyngeal cavity. So some of this movement could be the narrowing of the pharyngeal cavity, which would be for muscles like the superior constrictor, or they also might shorten and elevate the pharynx, like the stylopharyngeus. So these muscles also share a common speech function, which is that the pharyngeal muscles will alter and shape the tension of the pharyngeal cavity to help change the voice quality and ensure that the resonance is appropriate, and will also help to differentiate between nasal and non-nasal sounds. So right here is the facial nerve, and this nerve's primary function is that it will control facial expressions and facial movement, but it also has very important sensory and automatic functions. So for speech and mastication, this nerve is very important because while it does not directly control the muscles that perform the mastication movement, its functions in facial muscle movement and the saliva production needed in mastication are very supportive roles that are needed for effective and comfortable chewing. So looking in the oral cavity located underneath the tongue, we have the glossopharyngeal nerve, and this nerve's primary function is that it is responsible for providing both sensory information and motor functions in areas like the tongue and the pharynx, which are both very important in the processes of both mastication and speech. So again, looking specifically at more that speech and mastication role, it will enhance saliva production, and it will also provide sensory feedback for effective chewing, as well as facilitation of the initial phases of swallowing, such as that chewing and that tongue movement, pushing the food back. Again, looking at this posterior side of my model, this yellow right here represents the vagus nerve, and this nerve's primary function is that it is responsible for the autonomic control of things like managing heart rate, as well as providing sensation to parts of the ear, the pharynx, and the larynx, which are all very important in mastication, and it will also innervate certain muscles needed for mastication and speech. So again, looking at those mastication and speech functions, it supports mastication indirectly by coordinating the swallowing process, as well as protecting the airways and facilitating the initial stages of digestion and mastication. So looking at my model as a whole, the anterior to posterior transit will refer to the process of moving a bolus from the anterior part of the mouth towards the posterior of the oral cavity in preparation for swallowing. So the bolus is formed through chewing. So when you take a bite of food, you will chew it and it will mix with saliva, which looks a little bit like this, that up and down movement of the teeth, but also that side to side, making that rotary chew. And as you're chewing, the tongue will be pushing the bolus from the front of the mouth to the back. And then as the bolus is making its way back, it will eventually reach the posterior of the oral cavity, and the soft palate will elevate to close off the nasopharynx. So then once it does go down, it won't end up coming back up your nose. It'll go down and enter the esophagus. There are also several reflexes involved in mastication, and these reflexes are very important because they help to coordinate, regulate, and protect the muscles and structures that are involved in chewing. And these reflexes are automatic responses that help to ensure effective and safe mastication. Some examples of these reflexes include the chewing reflex, which controls the rhythmic movement of the jaw during chewing, so that up and down movement, we don't have to think about consciously doing that. It's more of a reflex that our body just knows to do. And then there's also the gag reflex, which will help to prevent any unwanted food or food that isn't ready to be swallowed yet, to keep it from coming down the esophagus. So that gag reflex is triggered to keep that food out of the esophagus if it's not ready to be swallowed yet safely. Another essential part of mastication is pressure changes within our anatomy, and these pressure changes are essential because they help to aid in swallowing and the breakdown of food and the formation of a cohesive bolus, as well as the transport of the bolus through the digestive tract. So there's a positive pressure created in the mouth when the bolus is pushed against the roof of the mouth, and then this positive pressure is maintained in the oropharynx by the soft palate elevating to close off the nasal cavity. And then when the pharynx constricts around the bolus, the pressure is again increased. And once that bolus has entered the esophagus and squeezed down, the bolus will reach the lower esophageal sphincter, which will create a negative pressure to help guide the bolus into the stomach and out of the esophagus. So the first anatomical impairment I chose to look at was Bell's palsy, which is a condition that is caused by damage to the facial nerve, and it can lead to either weak or even paralyzed facial muscles that are needed for controlling the mouth and mastication. So dysfunction of the facial muscles makes it challenging to keep food between the teeth during chewing, and it can often result in food escaping from the mouth into the cheeks. And it will also affect the bolus formation in prolonged chewing. And the second anatomical impairment I chose to look at was micronathia, and it is a congenital condition that it was caused by the lower jaw being smaller than usual, and this impairment will limit the ability to close the jaw properly or properly bite the teeth together, and it will reduce effectiveness in mastication, and individuals may have difficulty biting down, cutting food, or grinding food sufficiently, which impacts the overall efficiency of chewing. All right, and that is my mastication model. Thank you so much for watching.